phone radiation can cause cancer. Drinking some herbal tea can cure cancer. The sugar feeds cancer.
So when we hear the word cancer, we always look at a little negative way. The preparation start as the patient enters in the OPD. It's not on the table. Maximum prayers happen in hospitals, not in any temple, not in any gurudwara, not in any mosque, or not in any church.
Have you ever wondered if cancer is wiped off completely? What would oncologists do?
तू आस पास है खुदा, तू आस पास है खुदा.
So I remember the last time we were on this show, I remember you as a very calm, composed, with a deep, insightful person and with a strong sense of balance, both personally and spiritually. So welcome, and it's always great to have a conversation with you any time of the day.
Yes, thank you, Dr. Lakshmi. It's pleasure and honor to be with you. I keep watching your podcast. I mean, as a host, you keep asking to various personalities of medical, non-medical people, and I get intrigued the way you ask questions and the way they answer. I think there's a lot of unfoldments about life, about profession, about career, everything. And it's honor to be on this hot seat with you.
Great, great. And that's coming from you. That means a lot to me.
Thank you.
So, doctor, you're a cancer specialist, a pet lover, a devoted family member, and also a writer, truly living an unstoppable life. So how do you juggle it all, and what keeps you going?
To be honest, I think you know more about myself rather than I know. I'm very happy that you know I am a dog lover. So many things. How do you know about me? I think social media and
A
also
part of
personal
it,
discussion.
yeah.
Truly, I'm happy. Yes, I think now the most talk or discussed thing is work-life balance. But I truly believe it's not work-life balance. It is integration of work and life both. Yes, as a doctor, I have a primary responsibility to treat the patients, to give them healing hand, to give them hope, to treat them to the whatever best resources available with us. But at the same time, I am a father. I am a responsible family member as a son, as a husband, and there are so many things in life. So you cannot be, one role wonder. I believe we should be holistic wonder. It is not this or that. It is always this and that and that and that too. So I think a holistic wonder what keeps me driving, motivating for the patient, for the family, and for the society.
I think that's very beautifully said, Dr. Sachin. So what made you choose this specialty, that is cancer? I mean, did you ever question yourself? Because historically, as you know, that this field has more challenges than success.
Yes. This same question I had asked myself when I completed my MS General Surgery, and then I appeared for the entrance examination for the MCH super specialty. I'm talking about 17, 18 years backstory. When I chose oncology, a lot of people, including my own family members, they ask me why you are choosing cancer. Because at that particular time, or even now also, when we hear the word cancer, we always look at a little negative way. A stigma or dogma is associated with the cancer word itself. But what motivated me or drove me that point 18 years back is there are very, very few specialists in cancer available even today. So there should be somebody who can, right from prevention to the diagnosis to the treatment, can take the onus or responsibility and change the society. So that thought came in my mind, and even though it was little hard work, even though the road was not clear, even though I was not looking the greater picture, but I feel somehow that was my calling. Today, after 20 years, I'm very happy and very, very satisfied that I chose this field.
No looking back.
No looking back, and that is the history.
So, talking about cancer, Dr. Sachin, do you think that we are at this stage today that we know everything about cancer, or are there some mysteries yet to be uncovered?
Yes, science is driving, research is happening, but what is happening is, yes, few of the mysteries we could solve, but there are still many more to come. And I think human intelligence, or the curiosity to know more, or always asking the question why, that is happening. A lot of genetic things are happening, and a lot of mutation studies we are doing, and now we are doing a personalized medicine, precise targeting, and also immunotherapy. So there are new robotic surgeries, new technology of giving or delivering the radiation. So those kind of fascination always keeps the driving. And yes, there are many more mysteries to unfold, and I think the human intelligence will always give the answer. And on top of that, now artificial intelligence is also at our backup.
So, I think cancer care has come a long way since its inception, we can say, and it's evolving every day, and so are the facts about cancer.
Okay.
And also, there are many myths surrounding cancer. Some of the common myths that we get to hear is, phone radiation can cause cancer, drinking some herbal tea can cure cancer, the sugar feeds cancer. So, how do you react to these myths or facts, and what's your response like?
Our primary job is not only to treat the cancer patient, but also to create the awareness about the myths and facts. So like the common myths like radiation, yes, some sort of radiation can cause cancer, but not the mobile radiation. There are a lot of studies have been done, but I think everything in moderation is always good. Even the same is true with the sugar. Yes, sugar is basically needed for our day-to-day metabolism. It's not true that sugar, if the diabetic patient is there, the sugar will increase the cancer burden. No, it is not like that. But of course, excess amount of sugar is a poison. So I think everything in control, everything in moderation is a boon. If it is excess, then it is a poison.
I think the information is everywhere, especially now today with social media. We have the information all over, but knowing what is right, I think that's important.
Yes, yes, and how it coming from the authentic sources, and whether it has been some backup of science and research is there, that also we need to check up.
So, Dr. Sachin, you were mentioning about, now that the ORs, they all feel different, they all look different with these hi-fi robots everywhere. So, how do you feel when you don the surgical gown? I mean, does it feel like a movie or a sci-fi scene or something?
Even I also thought like that. Say 7 years back, when I got trained into the Robotic Surgery Institute, they told like it would be a video game, playing a video game, sitting on a console, and everything will be under your hands. Then you will do surgery. This is from one surgeon's perspective, but also from patient's perspective, they also ask me a lot of questions. Robotic surgery means they think that some robo will operate.
Correct.
It's not the doctor will operate, but again, this is a myth.
Yeah.
Not any robo is operating. It is us as a surgeon, we only operate, but the controls are in our hands. And the precision, the accuracy, the dependency on other staff assistant is minimum. And also the patient can discharge early. There are a lot of advantages of robotic surgeries.
I'm sure that you have to deal with most of the surgeries which are very complicated and that could be stressful.
Yes.
So, how do you prepare when you have a big surgery, coming up? I mean, do you just relax for a few minutes, or do you just play a song, or do you just meditate? How do you relax your way?
The preparation start as the patient enters in the OPD. It's not on the table. I personally take time to explain the patient about the issue, the disease it has, and how we are going to treat about it, the procedure, the side effects, the complications, and we give them the confidence that yes, there are issues, challenges, but with all the infrastructure and expertise available, definitely will come out of that major procedure very successfully. And then when we enter, one day before, we keep the list ready. There is checklist, WHO checklist, which we all follow. Safety is very, very paramount important of all procedures. And then we revise. In my mind, I always replay that this surgery, this step, this step, this step, and this step. So it's like net practice. You know why Sachin Tendulkar is famous or why Virat Kohli is famous? Because they do a lot of net practice before the actual match.
So perfect planning is very important for any surgery, you mean? And I'm sure that could be or that should be very stressful for you.
Yes, of course, I derive my energy every day from my exercise morning. It's not empty advice that I will give. 1 hour to our body and mind, 23 hours, the body will give it to you. That gives me mental stability, strength, and also as a stress release mechanism as well.
So you truly practice what you preach.
Yes.
So, Dr. Sachin, I always wanted to ask you, I mean, you being a very avid reader and you've also written a book. So what made you, I mean, how did you find the time, energy for this? I mean, I'm sure it's not easy.
One principle what I find is time for everything, everything in time. And second principle what I follow is place for everything, everything in place. So that makes your life organized. For example, as you told, the book which I have written, the name is I Am Unstoppable. So what made me to write this book is, as you asked so many doubts and questions, what patients need is stories. We all children by mind, our emotions, we are all childlike. So what motivates us is true stories of living legends. So in the book, I have collected a few patients of our patients and I told them to write their own story in their own emotions and journey from diagnosis to treatment, and how they have, from this side of life and death situation, how they have come onto the opposite side and they are living truly inspirational life. Name is I Am Unstoppable because I want to tell the patient that you are unstoppable. Cancer cannot stop you. So one thought, one emotion, one expression, it can have a ripple impact, and I think that is the greatest boon for the
And
patients.
it gives such a positive feeling, isn't it?
Yeah.
And the impact is so grateful. And it is so wonderful to know. I mean, you're doing such an incredible job apart from treating patients alone.
Yes.
So, talking about this book, Doctor, I recently read a book which is When Breath Becomes Air,
Yes.
which resonates with a similar thing, you know, and that's a
Exactly.
wonderful book.
Exactly.
Yeah. So, is there any book or song or be it a movie which inspired you?
One song which really motivated me, or it keeps motivating me, driving me, is Tu Aas Paas Hai Khuda. Have you heard?
Can you hum it for us?
It's from movie Anjana Anjani and sung by Rahat Fateh Ali Khan. It says, Tu aas paas hai khuda, tu aas paas hai khuda. And its songs that goes like, yes, there are challenges, there are issues in life, but you can overcome it. It's really very positive songs. At the end of the day, when you see andhera, you will find the sun rising. You will find some positive things.
So, I think now I have to add you as a singer in your traits of personality.
No, not as a singer, but I listen songs, music, and read a lot of books. One thing in life, I think, Dr. Lakshmi, what is my principle is keep the student amongst us always alive.
Yeah, I think there's always so much to learn, be it anywhere and from anybody.
Exactly.
So, Dr. Sachin, you're such an inspiration to be it as a doctor or as a person. I mean, do you see your children following your footsteps and pursuing medicine, or do they have their own ideas?
You're asking my children? No. In fact, my son now just he completed his 12th and he joined BTech in biotechnology. Always me and my wife, she is a radiologist. We always wanted our son to become doctor. Now children have their own dreams, their aspirations, and now there are so many opportunities are available. Yes, medicine is one beautiful field which gives you fulfillment in life, but also there are other equally important fields. We need researchers, we need biotechnologists, we need everything. And as a parent, I think we should always support them, their dreams, their aspiration. We should not thump our expectations on them, but always, yes, you tell them what you want and you always guide them, but you be as a backup plan, support, emotional support to them whenever they fall or whenever there are issues. you are. That's what my parent they did, and that's what I am doing to them.
So, if given a chance, of given the powers, what is that one thing that you would like to change or you would like to modify in this world as a cancer specialist or be it as a person? What is that one thing that you would like to change with your strength and potential?
This thought was always there, and that's why I written that book. As an oncologist, as a medical practitioner, I think there we need to create a societal change about the healthy living and happy living, because we know how the society is moving, how the diet has changed, and how people are become lazy, and they are not taking care of their own body. I think the best place to live is, it's not the five-star residence, or it is not the bungalow, or it is not the penthouse in Jubilee Hills or Banjara Hills, but the best place to live is our own body. So I think it's like temple. Many people or young girls or people, students, they have so many issues just because of the poor diet. Second, a lot of people are now become there is something called as biological cycle in our homeostasis that we call. How I can cultivate the habits of living close to the nature, getting at the sunrise, sleeping whatever possible way, eating properly with carbohydrates, proteins, fat, and micronutrients, de-addictions, like all this tobacco, gutka, smoking, drugs, and so many things. I won't go into details, but I think we should create awareness about this. It's not eating you, but it is also creating a problem with your family. They're all anxious about your health. So take care of your health. Fourth is regular health checkups or screening, what I always tell. Little bit spiritual inclination, why we are here, what is the purpose of our life, what we need to do, not only for ourselves but our family, our society. All those things are very, very important. And this one change, with my potential, with my position, with my knowledge and skills, I think I want to give to the society.
That's beautifully said. So, talking about healthy habits, how does your plate look like?
To be frank, I eat what I used to eat 20 years back, what my grandmother used to give me. Very, very simple. And I always tell, have your plate colorful. So always add white thing, copper, because like mooli or like carrot or like beetroot, these are greens, white, everything. If you add in your plates, I think each color has given some nutrition, some vitamins, so that you will be automatically healthy.
So, what's next for you, Dr. Sachin? Is it another book or some new surgical technique or something else differently?
New things which I am envisioning now is, yes, one more book I'm planning. Of course, this book I'm now getting translated into other languages like Marathi and one more language which people are asking for. And also I'm planning 111 stories again with different people. I think what happens, we don't know, but whatever happens, happens for the good. That's what I believe. And one more aspect of life I'm looking at, something new, is creating a foundation of Cancer Foundation, where all our patients who are treated from us or from other hospitals, they can come together, discuss their issues amongst themselves, and then they motivate others. So that one thing I'm planning as a new initiative to start the foundation. The name will be We Inspire.
That's beautiful. So, what's magical about being a cancer specialist? Is it about witnessing some incredible patient journey or dealing with some cool technology or mix of both?
Always, my boss used to tell, don't treat the patient's report, but we have to treat the patient as holistically. What is difficult is to treat him with the psychologically, with the counseling, considering his background, his family, his financial positions, and all other factors, to his travel time, destiny. I mean, all those things we have to keep in our mind, and that takes a lot of energy, and I think most crucial part of any treatment.
Have you ever wondered if cancer is wiped off completely? What would oncologists do? I'm sure you have many options to pursue.
Yes, if that happens, I'll be the most happiest person. I don't think I'll be unemployed, but I think that one dream of mine, that less cancer history, Even in my book also, I have written, make it cancer. I mean, cancel the cancer. So that I am the most happiest person on the earth if the cancer wipe out from the human society. If the cancer goes away, I think I will just keep writing new books, listening music, spend time with the family, and important thing which I will do is teaching the next generation through technology, through YouTube videos, through direct conversation. I think that would be my dream if the cancer gets wiped out from the humanity.
So, doctor, if not for a doctor as a profession, what would you be?
Will you believe my answer?
Yes.
I would have been a scooter mechanic who repairs the scooters and bike. Because I remember my childhood days, my father had a scooter, Bajaj. I remember the number also, MZH659. On every month, he used to do servicing. And curiously, I used to go to the mechanic shop. I myself used to take the scooter. I will open the bonnet, take out the plug, and do sharpening or cleaning it, and again putting it. So tightening some screws or bolts, and I would love that time. I think if not a doctor, I would have been some mechanic. And if I want to ask one question, will you answer?
I don't want to switch seat with you.
No, because you are asking now, you are being host for so many personalities in medical or non-medical. You keep asking for them so many questions. So from those questions or those insight, what the most befitting you or most that has touched your heart, or something like that?
Because I think we have done 200 episodes of Health Talk sessions.
Wow.
Till now. I think that's an incredible journey. And I think from every episode, as you said, I interact with doctors and there's something or the other to learn. They give me some different perspective. At the beginning, I said, the conversation. I still remember the conversation I had with you a couple of years ago.
Yes.
You were talking so much about spirituality, about balancing life, and about taking care of your body. I mean, that really resonated with me and that really stayed with me for so long. So it's not something, you might forget what you spoke, or you might forget what you heard, or you might forget what you saw or what you see, but you will never forget what a person made you feel.
Yes.
So that's something probably I can relate it with you.
Great. I think amongst all podcasts or whatever health talks we are doing, the most benefited person I think is you, because you get to learn or get to listen so many things. And also, as far as I know your life, I think you are also a quite fantastic role model, living life with balancing every aspect of life.
And finally, Dr. Sachin, if there is one message that you would want our viewers or listeners to take from this conversation, what would that be?
Life is holistic. It is not this or that, it is this and that. So, as I told, body is our temple. It is the best place to live in. So, please take care of your health, and in turn, the body will give you 100 folds. Because when I take rounds in the ICU after my, examining the patient, I see the people there who are meditating, who are praying for the well-being. And always I tell to the world, maximum prayers happen in hospitals, not in any temple, not in any gurudwara, not in any mosque, or not in any church. So keep taking care of your body and your loved ones. This is the my advice to all the society, all the people, and my near and dear ones. And second advice which I would give to the medical aspirants who wants to pursue the course in the medical fields, whatever it is, maybe oncology, maybe cardiology, or maybe whatever it is. Other advice I would like to give is, yes, hard skills, to acquire hard skill is important in your day-to-day practice, treating the patients or doing surgeries or embracing the new technology. But at the same time, the soft skills are also equally important. Communicating to the patients, taking the proper history, or counseling them during their treatment plans. So I'll summarize with one thing. that we all know that Buddham Sharanam Gacchami, Sangam Sharanam Gacchami, and Dhammam Sharanam Gacchami. Means Buddham Sharanam Gacchami means Buddha is the enlightened one, whatever it is, your guru or your professional teacher or your whoever it is, the one who has more knowledge, more maturity, looking towards the life, learn from them. Second, Sangam Sharanam Gacchami, the people around you, the networking around you, your friend circle, your family people, you can, either you can be created or you can be destroyed with the company you have. So, Sangam Sharanam Gacchami, have a like-minded, good people around you, which will always give you the positive outlook towards life. And third thing is, Dhammam Sharanam Gacchami means Dhammam is something good literature. It could be good literature, good book, or good YouTube videos, or good podcasts, or good audio books, whatever it is. Knowledge can come from any way. Just you have to keep your eyes and ears open to engrass it like a blotting paper and make the life beautiful, worthy of human being.
Thank you, Dr. Sachin. It was such an insightful and meaningful conversation that I've had with you.
Thank you. Thank you so much. Uh, Answering your question, I was really so much feeling happy, and it was so nice experience with you and all our team, audiovisual team. I think the message will go on about healthy living and happy living. Thank you very much, Dr. Lakshmi. Thank you.
So this brings us to the end of this episode. Hope this episode was informative, and don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.